Chronic cluster headache happens in about 20% of patients, and in almost 3/4 of them starts as chronic, while in 1/4 starts as episodic that evolves into the chronic form. We don't really know why it happens, but we should take in mind that using the proper preventive medication, we can try to stop both episodic and chronic headache and ease patients' pain. Sometimes we might also want to change some factors or situations that could aggravate cluster headache. For example, quality of life, concomitant medications, other disorders that could play a role. So, cluster headache has been stereotypically described as a strictly unilateral headache, and this is true. But it's not uncommon that cluster headache can switch side. As a matter of fact, it happens in about 10% of cluster headache population, and they can have a side switch between bouts, within bouts, or even within attacks. Side shift in cluster headache can be sometimes confusing even for physicians, but we should remember it's something that happens, and it indicates that there is no structural reason to cause the disorder, but rather a functional reason. Factors like smoking, overusing or even using alcohol, being overweight or obese, and very recently we know that suffering from sleep disorders, sleep apnea, or bruxism are factors that could aggravate cluster headache. So a patient with cluster headache should try to manage or avoid these things in order to improve his health.